Now let's study about normal pressure hydrocephalus. Normally the CSF pressure in a patient is in a person is about 50 to 180 mm of water. So what happens in NPH is that it increases to 150 to 200 mm of water. The reason is that there is a decreased CSF absorption due to subarachnoid hemorrhage or meningitis. Whatever could be the cause, there is increase in CSF pressure. All right. So this increase in CSF pressure leads to a gait ataxia, urinary incontinence, and dementia. So the gait the person acquires is known as a magnetic gait. In this, an external hip rotation and a low ground clearance, along with a shorter stride, is noted. All right. On an MRI, you can see uh, there is a trumpet sign. Also, you can clearly appreciate that the ventricle has increased in size, right, from its normal counterpart. The treatment shall be a Miller-Fisher test. In a management, we shall have to do a Miller-Fisher test, in which when the lumbar puncture is done, we drain about 30 ml of CSF. If the patient improves, in the sense that the gait and the cognition of the patient has improved, if the patient improves, we understand that it's normal pressure hydrocephalus. So we do a ventriculoperitoneal shunt. We make a ventriculoperitoneal shunt. Thus, CSF now drains into the peritoneum. So it leads to the management of this disease. Alright, let's revise what we have just read. In normal pressure hydrocephalus, the CSF pressure, normal CSF pressure is 150 to 180. In NPH, it increases to 150 to 200. Note that the pressure is still almost inside the normal limits. Alright, that's why it is called normal pressure hydrocephalus. The reason is that there is a decrease in CSF absorption due to SAH or meningitis, leading to increased CSF pressure, which shall be on the uh, raised side, just not breaching the physiological limit most of the times. The clinical feature shall be that the patient shall have gait ataxia, which we shall say that he has a magnetic gait. In this gait, the external hip is rotated, the ground clearance of the patient is low, and he takes shorter strides. There's dementia, there's urinary incontinence. We should take time to visualize this magnetic gait. The external hip is rotated, external hip rotation. All right, the hip is rotated externally. There is low ground clearance. The ground clearance is low, and there is a shorter stride. All right. There is also dementia and urinary incontinence. On MRI, we see a trumpet sign. This is what a trumpet sign looks like. Let's zoom it in. So the ventricle is shaped in a particular manner because it has been pushed towards particular sides, leading to formation of this particular shape. This right. Also, you can appreciate over here how the ventricles have been stretched out. Right. For management, we first of all do a Miller-Fisher test. LP is done to drain 30 ml CSF. If patient improves, the gait and cognition of the patient shall be judged to measure if the patient has improved. We do a VP shunting, which we normally do in a hydrocephalus. Alright. So this was about normal pressure hydrocephalus.